Welcome to the Higher Power Podcast, presented by Higher Power Sports PT, the show dedicated to helping active individuals like you unlock your full potential through expert insights on injury prevention, performance enhancement, and recovery. Kurt Kessler is a board-certified specialist in sports physical therapy and an athletic trainer. In each episode, he and his guests bring you the latest evidence-based strategies to help you move better, feel stronger, and stay injury-free. Let's learn together.
Hey there, everybody. Welcome back to another episode of the Higher Powered Podcast. I'm just going to take the opportunity here to share a couple thoughts based on some recent events that I worked, just to try to help really just the masses. It's going to be geared mainly towards parents of young athletes, but I think athletes of any age can stand to hear this message as well. So a little bit in here for everybody. But basically over the last week, I don't know, 7 to 10 days, I worked a series of events. The first weekend was a huge lacrosse tournament, girls lacrosse tournament. It takes place every year here in South Central Pennsylvania. And gosh, they have teams from all over the country. There's like 400 some teams. Pennsylvania, New Jersey, New York, Connecticut. Where else do we have? North Carolina, Florida, Texas, Oregon, Colorado, California. Just like this massive tournament. And it's a huge recruiting event because there are college coaches from every major D1 school, a couple D2 schools. But it's a really big recruiting event, and it's a really well-run tournament. It's always an awesome tournament to work. They treat us well as medical providers. And so this tournament, the first weekend is geared towards like high school age girls. It's that basically, yeah, like the level of high school kids that are getting recruited for these big programs. And so it's really a fun event to work every year. And then the following weekend is this pretty much the same tournament, except it's not heavy on recruiting because it's more like middle school age girls. But it's the same idea. It's the same organization that runs the tournament. It runs very similarly to the first one. It's just, for the younger girls. And then in between those 2 weekends, I had the opportunity to work a couple shifts at the Rising Stars Boys and Girls Football Camp at Millersville University. And that was my first time working that event, and it was pretty cool. The first half of the week is all focused on boys. It's non-contact, just helmets only. And I won't do the greatest job of describing the atmosphere, but I will say it is an extremely well-run camp. It's about more than just football. It teaches these boys and girls later in the week, I'll get to that, about managing money, managing life, managing influences. And it's a lot of technical stuff on the field. It's also stuff in the classroom and just life in general. And I think it's a really well-run camp. But as I worked these events over the past week, I kind of picked up a little bit of something from each one of the events, and they all have some overlapping themes. So I'm going to start with the first one, the big girls lacrosse tournament, the big recruiting event for high school girls here. I wrote down a couple takeaways throughout the week that I was working, and I'm just going to kind of hit them one by one, give you some examples of what I was seeing. And then at the end, I will just kind of package it all up into some brief takeaways for parents and athletes and anybody else who's listening here. So my first observation at the girls lacrosse tournament was that parents have nowhere to turn for information and guidance. And I say that because year after year, I think I've worked this event 4 years in a row now. Year after year, the same things are coming up. And it shouldn't surprise me. I guess it really doesn't surprise me, but it does bother me that there's not more being done about it. And I think it all stems from parents not having anywhere to go for good information and guidance, especially when it comes to injuries and managing injuries, because a lot of these girls are going from tournament to tournament to tournament, showcase to showcase to showcase. And most of their summer, especially depending on where they live and where they go, like I said, there are teams and girls from all over the country that come here. And then I would talk to them as I'm like taping an ankle or doing an evaluation. And then after they would leave here, they have a college camp that they're going to in a few days. And the next weekend's another tournament. The next weekend's another tournament. And they're just kind of like piecing together what they can. But as I talk to the parents, like I'll ask them, like, do you have a good relationship with an athletic trainer at home or a physical therapist or a sports med doc? And like some will say, yes, one of our parents is a PT or one of our parents is a doctor. And so they'll kind of lean on them for guidance. But the vast majority of the parents really, I just get this takeaway that parents just don't have anywhere to go to get information, to get guidance, and to know what to do or how to manage these injuries. And so what happens is a lot of these girls carry these injuries all throughout the summer through a very intense tournament and travel schedule and camp schedule. And like they're just getting patched together from one spot to the next while they're traveling. And in all honesty, there's really not much else they can really do when their schedule is what it is. But as an athletic trainer at these events, I mean, our role is we don't have any follow-up care with them. It's just evaluate them if they're injured, decide if they can play. There's a lot at stake in these tournaments. So like managing risk really is a big thing. And then it's just like kind of providing them what they need to get through the day or through the weekend, and then, basically ship them off to their next site. And in some ways it makes it easy on the athletic trainer because it's not like we have to come up with this whole giant plan. We're really just helping them get through the weekend because that's what our job is at that specific tournament. But I just come away with this feeling like, man, there is so much opportunity and so much more that can be done here. But these kids are just getting patched together and moved on to the next game or on to the next site or on to the next tournament. And so, like I said, there's a lot at stake in these tournaments, especially this high school one where there's a lot of recruiting and it's very important that girls are on the field. And again, when I'm talking to these athletes or I'm talking to these parents, some of them are already in rehab, which is great. That is like the best thing I hear, the best first step, because at least someone has eyes on them. At least they have like a home base to go back to for their care, for their injury, for rehab. And so I'll ask them what their rehab looks like. What are they working on in rehab? And some athletes are getting really good rehab. Like they'll tell me what they're doing, and in the back of my mind, I'm like, that's great. I would probably be having you do the same thing. And then some other ones, not really getting the best rehab. Like I've said this a number of times on this platform. You can go back and listen to my episode about sports physical therapy, a couple other ones where it's just like athletes need specific care. And what I mean by that is if I'm someone who just sits at a desk job, goes home, makes dinner, sits on the couch, like if that's my goal, that's the lifestyle I'm living, fine. It doesn't require a whole lot of like nuance. It doesn't require a whole lot of thought or progression or just like specificity. But some of these athletes, they need to be able to sprint. They need to be able to stop. They need to be able to cut. They need to be able to jump. They need to be able to get hit. They need to be able to get off the ground. They need to be able to throw or catch or whatever the case may be, swing from bar to bar. And their rehab just isn't matching the demands of what they need. And I say that because like it's very clear to me that if an athlete can be on the field, like doing a couple clamshells probably isn't going to make a big difference for them. Yet that's what they're getting prescribed in rehab. So some are getting really good rehab, which is great. Some are getting not so good rehab, which is not great. And then some just aren't getting any rehab at all. And one reason is because the parents just don't know where to go, or they're trying to get through the busy schedule before they have time to do rehab, or they really just don't understand I don't want to say the significance of their child's injury, because oftentimes these injuries aren't like significant in terms of like preventing them from playing, but they're just like chronic or nagging injuries that either just won't go away, or they're affecting them enough to affect their performance, but not enough to keep them off the field entirely. And so I kept thinking, like, yes, there is just so much opportunity to help these athletes, and I feel like I am in a unique position in comparison to the rest of the PT or rehab field, where like I have the ability to like adapt rehab based on what someone's schedule is, adapt rehab based on whatever sports they're playing, have come up with a plan to either like get them through a few week stretch and then like adapt when they have more time. Like I just feel like the service that I offer is so adaptable and so easy to take on the road. But I'm not quite sure what all I can do about that. But I do think I am uniquely positioned to kind of help with those types of issues for people that are on the go quite a bit. And I say that, I'll give an example here. There's a woman that I'm working with right now. She's not an athlete, but she's a yoga instructor. She works in a barn for a lady and takes care of horses. And so she sustained, I would say, a moderate knee injury a few weeks ago. She was working with me for a different issue, and then right towards the tail end, she sustained this knee injury. We kind of shifted gears and started focusing on the knee. Well, the owner of the barn was going away on vacation or going out of town for maybe 2 weeks. And so it was her responsibility, along with her boyfriend's, to basically care for the barn, care for the horses. And I've never done a job like that, but based on what she describes, and anyone who has will tell you that it's pretty laboring work. It's pretty tough. It's a lot of hard work, and if you have an injury, it makes it way harder. So we shifted gears from like a full rehab focus. Like, you know, in the normal groove, she may go to work, do her rehab. I think I mentioned she's a yoga instructor. She might teach a yoga class, and just kind of go about her day. Whereas like in this stretch, like her workload, she had no other help, no other option. She had to push through it. And so we built a plan that was going to, one, still work on the things that would need to be achieved long-term. Like we still worked on getting her knee motion back, bending, straightening. We worked a little bit on just balance and getting some weight through that knee to make the whole leg work just a little bit. We worked on some functional exercises, but not dosed very intensely. It's more just, we're just trying to restore basic function of the knee. And like I had to be mindful of her increased workload when she's doing all this hard work, and just kind of make the program match what she could do physically. And so that, like, having the ability to shift focuses and shift maybe even intention of a certain stretch of time. And then when the owner of the barn, the owner of the horses came back, then we kind of shifted again, because she had a little bit more rest, a little bit more capacity to do more intense exercise. And the stuff that I'm giving her now isn't even that intense, but it's still a step up from what she was doing. And so I say all that just to I guess, for lack of a better term, highlight what I'm able to do for people in these situations, because like I said, like each week is going to be a little bit different depending on what demands are going to be placed on them, what the schedule looks like. And sometimes that schedule is not optimal for rehab or not optimal for healing, but stuff just has to get done. And so I think about, like, if someone was coming to see me in the traditional rehab setting where I worked before, like I would maybe just be, I don't know, keeping their program consistent, maybe doing some hands-on stuff to make them feel good. But like the benefit of coming in and, working through the same thing for week after week probably wouldn't be as convenient or as valuable to them as what I can do in this setting, where I get to see what happens week after week. I get to adapt based on their response. And I'm not saying that people in the traditional setting can't do that, but I feel like I'm uniquely positioned to like have that day-to-day conversation, have that day-to-day touch point where like, hey, how's it going? What'd you feel today? And just kind of work with them through the ups and downs versus like, okay, let's keep everything the same. Come back and see me in 2 days and whatever. Come back and see me next week, where like I get to just walk them through and be with them in some form or capacity each day. So that was kind of a long way to just kind of give an example of just how I'm uniquely positioned to work with people in that way. So that was my thought for that. Then I go on to working this Rising Stars football camp. And I can say this, it's probably this way across the board in all sports as I'm thinking about it, but it was definitely on display this week at the football camp. High school boys, much, much more needy than high school girls. I don't know if it's because they're just used to having a trainer around at all times or used to utilizing their resources, or maybe the underlying truth is probably boys are just not as tough as girls. You can convince me on that too. But the same theme still applied. They were also carrying injuries through the summer from camp to camp to camp. One of our athletic trainers was helping a kid there, and the kid said, yeah, I've been going to camps for 3 weeks straight, and my knee still bothers me. It just, week after week, it feels the same or it's getting worse. And the same thing is true of the lacrosse tournament I was just talking about. It's just a busy time, a busy summer schedule for these athletes because they're either trying to improve, which is awesome, trying to get recruited, which is great. But there just isn't a whole lot of wiggle room when you're asking that much of the body and it doesn't quite have the capacity. And you get to the point like these camps are more intense than regular practice in a lot of regards for several reasons. One, when you're at a camp, whether you know people or not, like you are trying to prove yourself, you are trying to stand out, you are trying to get noticed by either coaches or recruiters or whatever the case may be, whoever has connections, and you are just pushing yourself to like max effort every day. It's summertime. It is hot. You're sleeping in a dorm or sleeping definitely away from home, and so your sleep quality is probably not great. So it's just it's a good recipe for just the body breaking down, and that's what we see. I worked with a kid. He had he told me he had a knee issue for several months now, and just again going from camp to camp. And we're trying to my thought process when I'm working with someone like that is, okay, you paid for this camp, you want to be involved, we'll do everything we can to get you involved. I'll try my best not to hold you out of stuff because the whole purpose of it is to get out there and, work. But there are some kids that just can't quite work through it because their pain or their injury is just holding them back too much. Another kid, he had hamstring issues on both sides for months and started running at the tournament, at the camp. And it was the second day we had to hold him out because he literally could not run because both hamstrings were bothering him that much. And that's a scenario where, he's had this issue for months, hasn't done any rehab, hasn't done anything for it, yet he still goes to camp after camp and is just trying to push through it. Now for him, football season's right around the corner. And so it worries me for him that he's kind of going to run out of time and it's going to be something that plagues his whole school season. And then so many kids come to get their ankles taped and they roll their ankle at this camp, just kind of play through it. They go to the next one, they roll it again. And again, it's this theme of we're just patching kids together week after week. And again, it's the best that we can do because we don't have any follow-up with them beyond that week. They have their own schedule, they have their own rehab, maybe. And I will say there is more information out there now for parents. I still don't blame the parents, even though there is more information out there. But here's a story going back 21 years now. The world was a lot different 21 years ago. But I was at a team camp for basketball in the summer of 2005. Is going into my freshman year of high school. Went up for a layup, landed on my ankle, twisted, big pop, blew up to the size of a grapefruit. I was done for the rest of camp. And back then, again, there just wasn't that much information out there, not good information. And if there was, my parents definitely didn't find it. And so the approach back then was, well, just rest it and wait till it feels better. So what did I do? That summer, I sat there with my foot elevated and played PlayStation or Xbox most of the day throughout the summer. Wasn't going to soccer practices in the summer because it was injured. After about 6 weeks, felt quote unquote normal. And then I just went on playing like that. And the reason why that's important today is because I've had a number of ankle injuries on my right side since then. And had I had proper rehab at that time, I'd be willing to bet the severity or the frequency in which I injured my ankle since then would have looked a lot different, would have been much less. Because what happens is when you, and I actually just talked to one of our high school coaches about this today who's having issues with her ankle. We roll the ankle because it's an injury that, most people play through, or it feels a little bit better within a week, or you can tape it up and keep going. Like our society has just kind of said like, oh, ankle injuries, just give it a week and get back out there, or give it a couple days and get back out there. Or in my case, give it 6 weeks and get back out there. And if that's the approach that we're taking, we're really not addressing any of the problem. We're just telling our bodies, okay, well then find a different way to move to play the sport. Because if you're not getting good rehab, you're going to be loading your foot or your ankle or that whole leg a little bit differently, and then other things are going to start to feel painful. It's just we should treat it like any other body part that, you injure it, do good rehab, and then you don't have to worry about it, hopefully, again for a long time. So with all the information that's out there today, it makes it a lot easier, but I still don't blame parents because they just might not have anywhere to turn for that. And one thing, when I started my business, one thing that I really wanted, partly because I feel like it's one of my strengths as an athletic trainer and a medical provider, is I feel like I do a really good job of getting people where they need to go. Not every patient, not every athlete is going to respond as well to the same therapist, or not every athlete is going to respond as well to the same doctor. Or there might be some doctors or some therapists that have really strong skill sets treating a specific thing. So I'm more likely to funnel someone there with a specific injury than someone who is not quite as good or not quite as experienced in a certain area. So all that to say, like anybody who's listening to this, if you are needing guidance, if you need direction for who to see or what should be my next course of action, like I'm just a regular guy. Like, you can send me a message, you can approach me. It is not a bother whatsoever. I'm very happy to help people in this regard, because in my heart, I just want them to get the right care so that they can not have to deal with injuries for the rest of their life, or not have to deal with these nagging things, and just get it taken care of. So if you're listening to this, you have aches and pains, you have an injury that's been bothering you for a while, like, just reach out to me. I'd be more than happy to have a conversation and help direct you where you may need to go. And then the last part of this, the second girls lacrosse tournament that I worked, this is the middle school girls. One thing stood out with me with this age group and these teams more so than the high school teams, and that was there is no medical staff associated with these teams or these clubs. It's not like they travel with an athletic trainer. It's not like they have a team doctor to report to once they get home from the tournament. And because of that, parents are forced to become the primary medical providers for their kids. And I say this, I've seen a number of different things this weekend, and I'll highlight them quickly. One, this one girl was on the sideline. She actually wasn't playing. She was in a boot, but she was on the sideline. She was real pale in the face, got really nauseous, sweaty, started spitting up a little bit on the sideline. And so I don't know if someone called for her parents or if her parents just saw and came over, but parents came, sat next to her. They were, kind of triaging their own child based on what they knew. And you could tell that they have had experience with this, not necessarily as medical providers, but having to step up and make decisions, medical decisions for their kids at these events because there's nowhere else to turn. And so we worked through that situation. There's another one. Kid gets either hit in the head or rolls their ankle or whatever, checking them out on the sideline. Parents come running over from the other side of the field. And I completely understand why they do it. It's because, one, they care about their kids, which is great. Two, it's because they have just taken on this role. Like, there's no one else here to care for them, so I better go over and see what I can do. And so it's great. It's great that parents are able to do that, but I do think they would be better served to be able to have someone that they know that they can just text or call or just ask for guidance on what should we do for this or what should we do for that. Now, like I said earlier, some of the parents are doctors or PTs, and they kind of take on that role for the whole team. Sometimes we get a call on the radio, we go to the field, and one of the parents is sitting with one of the athletes because they're a doctor and they were able to kind of help until we got there. But there's no consistency with medical care. And again, these situations, we're going from, tournament to tournament to tournament, and the athletic trainer sees them one time or maybe for one day and has to kind of just send them on to the next person. And there's no continuity of care. That's just, again, patching them together from one step to the next. One of the, it's kind of funny, also kind of frustrating. And myself and the other athletic trainer I was working with, shout out Rob Snyder, we had this situation. One of the girls came over with her dad. It was 5 minutes before their game started. She was having a little bit of knee pain. And the dad's like, I don't want to say frantic. That's not the right word, but, pressed for time because the game starts soon. And the dad's asking us over and over again, like, well, isn't there some kind of stretch that she can do to make her feel better? And we kept telling him, like, you can stretch this, that, and the other thing. We don't know if that's the right thing to do because we haven't looked at her. We did like a 30-second evaluation, and the dad's like, well, can you tape her? Can you stretch her? Like, can't you just do something? And we both kind of look at each other like, in what world does someone have an injury or something that's bothering them, and there's like one magic fix that'll take it all away in 5 minutes? So I say that to make an example here, but I know for a fact there's a thought process out there like, oh, this is bothering me. Like, I'll just stretch it and it'll feel better and I'll go on from there. It's so short-sighted. There are things we can do to make you feel better in a short amount of time, but it's just absurd to me to think, well, can't you just like give her something that'll make her feel better in 5 minutes before the game starts? Because the human body doesn't work that way. The quick fix that everyone is looking for just doesn't exist. We can patch you up. We can make you feel better for a couple minutes, but that doesn't change anything long term. There is no quick fix for a chronic issue. It just doesn't happen. Something that's been bothering you for weeks, something that has you're at a tournament and you're overloaded because you're playing 5 games in a day. Like, there's no quick fix that is just going to make someone feel better. It's frustrating because that's what the expectation is for some people. But I'm just here to reiterate for the 9,000th time on this podcast that the quick fix, especially for chronic issues, just doesn't exist. And that brings me to my last topic here. We do a handful of tapings at these tournaments. When you think about like an ankle taping, and Rob explained this really well to a parent this weekend, what taping does, it was actually the same parent, the parent that wanted something done for her knee really quickly. Taping, especially if we're talking about an ankle or sometimes for the knee, there are a number of different tapings that we can do. But when you think about a traditional ankle tape, the idea is that we tape to restrict motion, to protect joints and ligaments from getting all the way to the end range, because injuries happen. These acute injuries, like when you think about rolling your ankle, it happens when a joint moves too far and a ligament gets stressed too much. So taping prevents, or at least significantly reduces, range of motion in a joint so that it protects it from getting to that end range. And so the problem that we often run into is that athletes and parents of this level think that, oh, if I tape something, it's going to make something feel better. Taping doesn't often make something feel better. It just helps protect it. Now, like I said, there are a number of different tapings that we can do for different things. But in general, when we tape joints, the idea is to restrict the motion so that we're protecting the injury a little bit. Not because it magically fixes the ankle. So I was kind of all over the place on this. Usually I'm a little bit more organized and structured, but this was really a podcast just to share some thoughts, share some just things that have come up over the past week, kind of haphazardly. But if I had to roll it into like 3 big takeaways, this is what it would be. My number 1 takeaway is that nagging injuries or chronic injuries need rehab. Rest does not fix them. Me sitting on my butt for 6 weeks playing video games, waiting for my ankle to heal, doesn't fix the problem. Yes, the tissue will be healed. The pain will go away to some extent. But what rest really does is it just turns off the alarm temporarily. And I'm not saying like don't rest. I'm not saying just like blatantly, blindly run through, every pain that you have. But I think we need to realize that when we rest and do nothing, when we do no rehab at all, it may turn off the alarm temporarily, but as soon as you go back to doing something, you're either going to feel it again or you're just going to be left at a greater risk of a bigger injury happening. And so my encouragement would be, if you have nagging injuries, if you are a young athlete, if you are a parent of a young athlete, or if you are a parent or non-athlete who still likes to be active, still likes to work out, and you have nagging injuries, do some rehab. Get some really good rehab, get some really good guidance through the process, and leave that issue behind you. It's not something you have to carry with you. It's not something you should carry with you. Like, just go and get the help that you need. The number 2 takeaway here is recovery and workload. So you can go back and, I've done so many on this. Episode 4 with Sarah Neal, episode 13, 14, 16, 22, 26, and 33. All those episodes center around either recovery or workload or some combination of the two. What I mean by that is going back to the football camp, where you have kids that are going from camp to camp to camp with the same injury and just like pushing through it. You're really not giving any time for recovery, and you're really not managing workload. You are just like dumping tons of work on an injured tissue or an injured limb or an injured body part. And the expectation should not be that it's just going to go away. I'll just push through it and it'll go away. What often happens is you push through it and you make it worse, or you push through it and injure something else, or you push through it, your body finds a new way to move, and then down the line, something else breaks down. So just keeping recovery in mind, like if you're pushing the body that hard, it's going to need time to recover. It's going to need time to rest. It's going to need some rehab. It's going to need some hydration and stress management. And then when we talk about workload, like my favorite analogy is like if you work 100 hours a week for 3 years straight, like you're probably gonna be burnt out. You're gonna be feeling awful. Versus if you have these ups and downs, if you work a normal schedule, if you take vacation time, if you get a good sleep regimen, and you're just like managing what you're able to do instead of just like pushing through it for 3 years straight, like that's going to go a long way in not only how long you can do it, but how effective you can do your job or play the sport or perform at whatever it is that you're doing. And then the last takeaway here, I kind of already did a little plug for myself, but the last takeaway is that there are newer options for rehab. There are newer PT options outside of the traditional model. And I'm going to say that I'm going to put it through the lens of these athletes who are going from tournament to tournament, these athletes who are spending most of a month on the road, athletes who, are maybe not be injured enough to sit out of their sport, but injured enough that they're not able to play the way they want to or the way that they're capable of. And I would just say, like, there are options to take PT in your pocket. There are options where you can have the guidance of someone in your pocket while you're traveling and while you're at these tournaments. There are options for someone to help you manage your workload in and out of season, in and out of tournaments, and they exist. We exist. I am one of them. So I would like to just for a second open some eyes to some newer PT options that might serve this type of athlete a little bit better than the traditional setting, where they may not have the daily guidance or the daily access to their PT, or they might not have those same checkpoints or not quite sure what to do while they're traveling. And so that's just one example to bring this home, and then I'll shut up, I promise. One example to bring this home. I just recently finished working with, he's 12 years old. He was a former world champion ninja warrior, and we've been working together for 6 months. I progressed him from the regional competitions to the national competitions to the world competition. And this past month, I really didn't do a whole lot of rehab with him, in the sense that, like, his performance was pretty darn close to 100% of what he needed and what he wanted to be. His injury was not bothering him. It's not like we were managing a whole lot of pain, but his mom still chose to work with me for an extra month. I from the start, the plan was to work with him until Worlds was over, to get him through Worlds. And even though I wasn't like doing a whole lot of rehab or a whole lot of like specific programming for him, I was still monitoring his workload, what he was doing in practices, trying to kind of fill the gaps a little bit in terms of what his body needed, and really just like be a resource as they're traveling to these things, as he's going through Worlds, like just being their guidance and monitoring and managing his workload. And so I think that's another area to highlight, where it's something that you're really not going to get in the traditional setting. It goes back to some of these newer PT options. But for this kid, like I really wasn't working with him in the same way that I had been the previous 5 months. Previous 5 months was all like progression and rehab and exercise to get him to where he needed to be, monitoring his workload so that we weren't throwing him out there and doing way more than he was trained to do. But again, it was just a resource for them to have as he was preparing for this huge competition. And that's one of the things that I've enjoyed doing, and I've enjoyed having the ability to help people in a new way in that regard. So just a lot of mismatch thoughts in this episode, but I just felt like it was important to get on here, kind of talk through some of these scenarios, point you to some resources, maybe open your mind to consider some other options or some new options, or even just consider like the first step in getting help so that you can do what you need and want to do. But yeah, big takeaways: nagging injuries need rehab, rest doesn't fix them. Paying attention to recovery and workload as you go through a busy schedule will pay dividends. And then just considering new PT options with more flexible or more guidance as opposed to just straight rehab. All right, that's going to do it for today's episode. Thanks to everyone for listening. If you're looking for ways to connect, you can always do so by finding my information in the show notes or find me on Instagram at Higher Power Sports PT. Thanks, and we'll see you next time.
That's a wrap for today's episode of the Higher Powered Podcast, presented by Higher Powered Sports PT. We hope you gained valuable insights on how to stay strong, move better, and prevent injury, all backed by expert knowledge in sports physical therapy and athletic training. If you enjoyed today's episode, don't forget to subscribe, rate, and review. Your support helps us bring more evidence-based tips and strategies to active individuals just like you. For more resources or to connect with us, head over to hpsportspt.com. That's hpsportspt.com. Remember, you've got the power to perform at your best. Keep training smarter, recovering faster, and living stronger. Just a reminder that the content shared in this podcast is for informational and entertainment purposes only. It should not be considered medical advice. Always consult with a qualified healthcare professional before making any changes to your health or treatment plan. Thanks for tuning in. We hope to see you next time on the Higher Powered Podcast.